Hi, and welcome to the next episode of Belly to Belly. It is great to have you here with us today. So today we're actually going to spend a little bit of time in the life sciences space, and we're joined by Mark Lesselroth from BioPort USA. Welcome, Mark.
Thanks for having me, Bill.
It's great. So the title of this conversation is around the myth versus reality of life sciences companies entering the U.S. market. We certainly want to kind of dive into that conversation. And just as for context here, our listeners are both companies, B2B companies that are looking to enter the U.S. market, plus also a variety of trade representatives that are helping and support organizations that are helping these companies come into the U.S. Just for a moment before we hop into that really interesting conversation, it'd be great to know more about you and about BioPort. Do you mind just kind of giving us a little thumbnail of your background and also what you're doing today with BioPort USA?
Absolutely. So first of all, I want to thank you. I appreciate this opportunity. You know, anytime I have the chance to spread the word, so to speak, or spread the gospel, if you may, it's a wonderful thing. So I am the president and CEO of BioPort USA, which was established in April of 2018. And the impetus behind it was I wanted to identify innovative life science technologies, be it biotech, medtech, pharma, in vitro diagnostics from around the world that could really improve our healthcare system. I know it sounds somewhat altruistic, but I've been around the world for a number of years. I was originally born in Germany and lived almost 15 years throughout my life in Germany. So both as a child, as a student, and then worked there. And as a result, I not only learned the language, thanks to mom, who's German, but I was also experiencing a lot of different cultures, not just the German culture. I traveled a lot and was exposed to a lot. And I recognize that while I love the United States, I think it really is a great country, that there are some amazing things happening outside. And, I don't know how much longer I'll live, but I thought with the remaining years here, I want to do something good and, find a way to introduce this technology just to make it easier on patients and make it easier on healthcare providers.
That's really cool and amazing. So, I guess I'd start with our thesis here, which is the myth versus reality. So, I guess what's the sort of paradigm that where you see companies that are life science companies that are coming into the U.S. What are the myths that they're sort of holding close or embracing that are challenging?
Well, I'm glad you asked. I think one of the number one myths is that they know the U.S. market. After all, we are a Western nation. Many of the international life science companies speak English. Many of them have traveled here either for pleasure or business. Some may even studied here or worked here. And so, the thought of, well, if I want to now do business here, how hard can that be? Versus, China, for example. I've met many people who think, oh my God, I don't speak the language. I don't understand the culture. I definitely need help. There's no way I can do this on my own. And with the US, they think, no problem, we can do it. And frankly, nothing further could be from the truth. They really don't understand the US market in terms of how we make decisions, whether it comes to buying something, selecting something, the nuances associated with the regulatory process. They sure as heck don't understand our reimbursement system because most of them come from a country that offers universal health care. So that's a big one in terms of a myth.
That makes a lot of sense. So, I would venture to say that many people in the U.S. don't understand the reimbursement system. So the idea that someone from outside the U.S. would understand it would be difficult. So when companies have these challenges where they maybe don't understand the sales process or the regulatory system, what challenges does it create for them? How does that handicap them?
Well, it's problematic because if they think they know the system, and then they go through and go about doing business as they are used to in their home country, many of them will invariably fail. They think it's good enough to, let's say, exhibit at a trade show, an industry trade show, find a sales rep or a distributor, sign an agreement, and hey, we're off to the races. And nothing further could be from the truth. And that holds true for American companies as well. But I think American companies, for the most part, know better. Those companies that are more successful in the United States are the ones that understand, what you need to do in terms of developing a sales strategy, what you need to do to support a distributor, how important your brand is in terms of influencing the purchasing decision. These are all concepts that, for the most part, are extremely foreign to the international life science community. And so many of them either fail outright or they do not achieve the success that they had anticipated because they weren't prepared to adapt and adopt the US way of doing business.
So, in sort of thinking about that, would you say then that, when you think about the biggest mistakes that companies make are, related to understanding the sales process and the reimbursement and regulatory process as they're coming in?
Well, among other things. I mean, I think the other thing that is, and we'll go back to maybe another myth, is that, look, I've developed a wonderful technology. America is the largest healthcare market in the world, which is true by far. I mean, numbers for last year were at $3.1 trillion. That's a big number. All I want is a piece of the pie, right? How hard can it be? And they really don't take into consideration that, what, maybe I need to do a little homework. Maybe I need to see what the competitive landscape is. Maybe I need to understand, what really is required. Instead of saying, well, I know I need FDA because without FDA, I certainly can't sell anything, which is true. And even there are misconceptions. They think it's pretty black and white. I can go to the FDA website, read what is required. And the truth of the matter is it's not that black and white. There's a lot of gray in terms of how things are even interpreted from a reviewer on the FDA. So unless you have a regulatory person that's on your staff that understands how the FDA works, and the same thing with a reimbursement person, and most of them don't. And I'm talking small to medium-sized companies. Certainly the large companies, the B. Brauns, the Siemens of the world, absolutely. I mean, they understand it well, in part because they have Americans on staff. But the rest of the crowd, they really don't. And I think they can find themselves getting into a lot of trouble real quick.
That's great, and certainly easy to see the challenges. So let's maybe shift from being sort of trying to find the challenges and talk more about sort of an ideal state. And obviously that you've worked with companies that are kind of on all ends of the spectrum. If you kind of imagine on a continuum. There are companies that really go through the process very well and not just have a good plan, but also execute it effectively. And then obviously on the other end, there are companies that don't and fail and bounce out because of that. When you think about the companies that are successful and obviously the multinationals and whatnot that you mentioned, but even on the small and mid-market size, the more market entry oriented, what are the things that they do that are that cause that success? What are the sort of bigger elements that help them both in terms of plan and execution get it right?
So you mentioned planning. A lot of them don't necessarily have a plan to begin with. So the ones that are successful, and I tend to use a metaphor of building a house. I said, whether you're French, German, Chinese, or, well, American, I don't think you'd ever build a house without having blueprints, because God knows what you'd have if you didn't. Well, why would you enter a foreign market, the largest healthcare market in the world, without having a go-to market plan, without having a blueprint? To have a better understanding. So the more successful companies, they have done their homework. They understand where their place is in the market. They understand who the competition is. They do understand some of the challenges and pitfalls associated with commercializing their technology. They certainly understand what has to happen from a regulatory standpoint because they've done their homework. And because of their size, depending on the scope of the work that has to be done and the cost associated with it, that's something else. Most of these companies, they totally underestimate how much money it will cost to successfully launch a product into the US. So the ones that do it well either have secured the necessary funding and resources. So it's not just funding, it's personnel. You need enough people to do this right. And then they look at, what's the end game? So based on any of the research they will have done or their homework early on, they'll recognize that, there's no way I can do this on my own under my own brand. So I need to identify a strategic sales partner. And in the biologics side in particular, because phase 3 clinical development costs a lot of money. We're talking one with a lot of zeros behind it. No small to medium-sized company can afford it. So in that case, the exit strategy, if you may, is to identify, a Johnson & Johnson, for example, where they can be in a position to sell their technology or license it to them and say, hey, you take what we've developed and bring it to the finish line. That's been the recipe for success. But I will tell you that probably, 90 or 95% of the companies that I've encountered from around the world don't do that. They don't have a plan. They don't have a go-to-market plan. They don't have a commercialization plan. They underestimate how much it really costs. And in the end, they sometimes have a mess on their hands. And the problem is that by the time they reach a consultant who might be able to help them out, it may be too late. The other thing that I will share with you that I think is important for your listeners is the Europeans in particular, and that's who I deal with for the most part, they are so fixated on their technology. And granted, they're the Swiss, the Germans, my gosh, they can make just wonderful technology. But, getting FDA approval is just the first step. And God forbid, there isn't really a need for the product in the marketplace. The greatest hurdle that my clients face, in my humble opinion, is the American physician. Why? Because they're set in their ways of doing things. They're certainly open to innovation, but if it ain't broke, why fix it? And so, if the international life science community has to know ahead of time, how is my product going to add value? How's it going to help the patient? And how's it going to lower cost? The whole concept of money and how much or how big a role it plays in our healthcare system, let alone in our economy, is again something that I would say the entire international life science community has no real or can't really fully comprehend how important it is, just because it's not something that they encounter in their own culture.
Yeah, that certainly makes sense. It's funny, as you were talking, I was thinking about a friend of mine who he has built several successful life science companies and exited. His most recent exit was about $130 million exit. And so their first 2 steps in building a company, and they do this, it's every 3 or 4 years, they get the band together and they go through the routine. But his process is really simple. First they pull the team together, then they identify potential acquirers in a life science space, and they find out what those acquirers have an appetite for. Something that acquirer is building that these guys can build something complementary to in some way, and then they go out and build that something and sell it. And they've done this over and over and over again. It's amazing to me that more people don't do that model. They, as you said, most folks who are innovators and inventors tend to be very product centric instead of customer centric. And these guys kind of take it one step further in that their customer, who they envision as their customer, is the acquirer. So they're talking to all the sort of the big,
which now, I mean, absolutely. But what you described is, I'll say, a very American thought process, which is the right thought process, by the way. You know, what is the end game? Are you going to sell your business? Are you going to license your technology? You know, what's your exit strategy? And again, most European companies, especially in the medical device side, I dare say they are so focused on developing a solution that can help mankind, which there's nothing wrong with that. On the contrary. But then you have to look at it through an economic lens and say, well, is there a business there? You know, I mean, I had one client who will remain confidential, phenomenal technology. It's based on artificial intelligence. He spoke quite good English. His mother was American. He spent time in the States. I mean, he really felt he was on top of his game. And as we were talking to physicians in the United States, while they were fascinated with the technology and thought, wow, this really could be a game changer, each and every one of them kept indicating, yeah, but you know, I can't get reimbursed for it. So I can't use it until there's a reimbursement code. And then it turns out that his technology is so innovative, there is no what's called a predicate device. So there's no existing CPT code that they could easily incorporate into what's called their healthcare economic strategy, thus, you know, working on a reimbursement strategy, that he would have to get a new one. And, you know, we said it'll take him between 18 and 24 months. Never saw it coming, and took his timeline for commercializing in the United States and pushed out by a minimum of 2 years. So not knowing these things. So you know, what your friend did is, you know, or does, is very smart. You know, the other thing that I think is smart about it, and I've seen it happen just the opposite, is he is going out and asking or identifying, what does the market need? Many of the companies I've encountered overseas will develop a wonderful solution for which there's no problem. You know, so again, they get so caught up in the science of it sometimes. I'm like, well, this is great, you know, and you know, I'm going to go on the record and say this. I think to some extent, the European governments do a disservice to their entrepreneurs, because they certainly want to spawn innovation and they want to support them. And they do so with grants, you know, 50,000 euros here, 250,000 there. It's not chump change. And they almost give them a false sense of success because they're nurturing these guys' ideas. You know, they're €500,000 into this, and it turns out that what they have, you know, maybe a great science experiment, but it's really not going to impact, at least not the US healthcare system. Now what? You know, and I dare say that if these organizations also had a better sense of, you know, what does the market require? Where, you know, what direction are we going into? And then how do we develop a solution for that, like your friend did? Now you're talking potential for more success.
Absolutely. And actually, I'll share one other quick thing with you. So maybe an idea for some of the economic development and trade people who are listening. There's a hospital in Boston, which, Mark, you know probably well, which is called Brigham and Women's Hospital. It's Harvard University's teaching hospital. But for years, and I don't think they're doing it anymore, but for years they did an event once a quarter called Pilot Shark Tank. And you know, obviously most pitch events, which this was a pitch event, most pitch events have investors as a panel, and the investors make comment and score, and in some cases get involved in the companies. At Brigham and Women's Hospital, it wasn't investors, it was physicians that were the judges. And they did two things that I thought were remarkable. One is the whole point of this event was for the physicians to see new technology, and actually the winner or winners, and there wasn't a limit to the number of winners, but it really depended on the quality of the solutions, was that they would be piloted within the physician's practice. And so, you know, you think of it from the company standpoint, it's validation, it's revenue, it's testimonial, it's feedback, it's all sorts of really great feedbacks. but that, I thought the brilliance of the event was actually the second half of it was the physicians talking about what's keeping them awake at night. And so, yeah, these were really neat. And, you know, we see a few of them that we can use today, but let's talk about, you know, where the greatest impact and what types of things that, whether it's reimbursement issues, whether it's the practicality of something or the demand for something in the practice, but getting, yeah, it's always interesting to see how far away in most markets the sense of demand is from innovation. And there's just a huge gap in most cases. So I think there are a lot of opportunities to uncover very much more significantly what demand is. And certainly it's the obligation of every founder to understand demand before they build anything.
Right. And I think the other disconnect, again, that I've experienced coming from the European side is they rightfully, I should say, they rightfully so, look at their invention from both a healthcare provider's perspective, but also a patient perspective. And unfortunately, I think in the US, you know, the ultimate decision of what's going to be used and how it's going to be used, you know, certainly falls in the hand of the physician's perspective. So what might keep a physician up at night, you know, is perhaps more personal driven, process driven, but not necessarily patient centric. And so, you know, somebody in Germany or France or Italy will have developed something to be really cool for the patient. And it's not that we don't, you know, the physician doesn't care, but he or she isn't necessarily thinking about it, you know, through that lens. And so, you know, therein then also lies part of the problem to say, hey, we've got this really great new widget, you know, looky here. The other thing I need to share with your audience, because I think it's really important, because I've seen this happen as well, where someone actually has a game changer. I mean, you look at this and you go, wow, this fits the American model. But unfortunately, a lot of international, so it's not just European life science companies, are extremely risk averse. So they're, you know, and they can be intimidated. America's the largest market, you know, the land of, you know, milk and honey, so to speak, unendless opportunities. But then, you know, how do we actually take advantage of it? How do we take on the 800-pound gorilla? Because we can. And so, you know, there also isn't a fault. And I think that if, you know, you mentioned something else about your friend, which I totally agree with, the team. So if they then, you know, had a little foresight or trust in saying, you know what, we may not be able to do it, but let's hire an American team. Let's hire an American CEO, an American VP of sales, who not only has the gumption, but may have the Rolodex and the connection, and then can take their technology, and obviously also has, you know, experience with getting FDA approval. And well, to me, that, you know, that's the perfect combination. If you're too risk averse to do it yourself, find the right partners, put the team together, you know, let them take it to market. And then it's still under your brand name, by the way, as opposed to giving up oodles of money by you know, putting a licensing agreement together with a large med tech or pharma company.
Yeah, that makes total sense. Well, let's kind of get this down to a fine point. So, yeah, if you had sort of 3 recommendations for life science companies coming into the U.S., what would be kind of the top of that list?
Well, I definitely think the number one thing that they should do is, you know, do some market research, do your homework, understand the marketplace and where your technology fits in. You know, I mean, you have to know that, because it's, you know, have a blueprint. You're building a house, for God's sakes. I think that would be number 1 on the list.
All right. And how about number 2?
Well, when you have the blueprint, you know, then you can go ahead and develop a go-to market plan, right? So you've done your research. Now you're going to develop your commercialization strategy. And it is a commercialization strategy. It's not something you're talking about. You're literally writing it down on a sheet of paper, not unlike, you know, I'm sure that you've met people, or even yourself, when you start your own business, theoretically, you're supposed to put a business plan together, you know, and there are different components to the business plan, including financial and marketing and human resources and how you're going to grow. Well, not unlike a business plan, you put a commercialization plan together so that you know what to expect and also anticipated costs associated with it so that you can plan for it. That would be the second step.
Perfect. And how about number three?
Number three is really, well, the obvious answer is execute, but it's to have a goal, know what your goals are, and in terms of what is it you're going to do with this? Are you going to go to market and ultimately sell your technology? Are you going to license the technology? Are you going to try to build a business? I think sometimes they just don't know. And I believe there's a big difference between doing business in the United States and selling your products in the United States. I mean, clearly there's a little bit of overlap, but there is. I mean, and there's much more involved and it's more costly to do business or to establish a business here. But if you did your homework and you have a plan, then you will reap the rewards. The return on investment will be much, much higher than if you decide to just, sell your product. But that's okay. I mean, as long as you know ahead of time what direction you're going to take this in.
So I have to share I lived in Texas for 2 years, and there was a bumper sticker in Texas and this today probably isn't that popular of a bumper sticker, but it said, "Gun control is hitting what you aim at," which makes me very much think of your relationship to goal setting. It's very difficult to perform well or towards something if you don't know what it is. So yeah, it totally makes sense. Which is a perfect lead in actually to kind of our last question, which I think in this context really makes sense, is how do we measure results? So obviously you had the front end, we have some goals, but how do companies kind of metric performance, and what would you suggest there?
Well, and there again, I'm pleasantly surprised sometimes, and maybe I shouldn't be, because a lot of the people I'm dealing with, and I do a lot of work with startups, because let's face it, innovation is ultimately coming from new companies. I don't, and even the big boys will admit it. I mean, that's why they're constantly looking at, what these small innovation or innovative companies are doing. The problem is you're dealing with either scientists or engineers who are brilliant people, but they're not necessarily the best business people. And so I'm pleasantly surprised to sometimes find that, they don't have measurements, they don't have metrics in place to say, how does this look, or how do they actually put something in place to measure success in the US market? I mean, the obvious answer is, what's my return on investment? So I put in a certain dollar amount, I have certain goals, sales goals that I'm trying to shoot for. Well, okay, that's pretty straightforward. But there are other forms of success. You might look at, hey, I need to identify 3 strategic partners that I want to be able to do, business with over the course of the next 12 months. Or I want to be able to do business in a certain area. I think that you need to be able to manage your expectations when you set your goals so that you are able to achieve them on the back end. Even a measurement of how long will it take me to get my product introduced into the US market. So that I look at it and go, well, if everything goes right, it might take 2 years. And that's the other thing. The timeline in the healthcare industry is unlike any other vertical market that I've ever encountered. It takes time. It takes time in part because you have something called the FDA, and then even on the reimbursement component. So even if you do everything right to introduce a new technology into the US market, will take 2 years. There's just no way around it. So what do you do in the meantime? You build little successes and you work on things, you do a pilot, you generate interest, you generate momentum, you get your key opinion leaders out there. And so even that could be a measurement of success, identifying the right key opinion leader and having him or her join your advisory board and have them go out and, as I said earlier, spread the gospel. Because we Americans can be very much influenced by what others have to say, especially people who we put on a pedestal. So, yeah, I mean, look, you can have a tremendous amount of success in this country if you do things right. You need to be able to take a little risk. you need to be prepared to spend a little bit of money, and you need to be open-minded to appreciate and understand how business gets done in the United States. I refer to it as, playing in the sandbox called, the United States of America. And if you do that, then you stand a great probability of achieving monumental success.
That's fantastic. Yeah, I like so much of what you said, but the idea of getting some key opinion leaders on board in that run-up time seems important strategically, not only for their feedback and evangelizing, but also I would think in every space within healthcare, there are only so many, really good top-end key opinion leaders. And with everyone that you add to your ledger, you take them off the field for somebody else as well. I would think it's competitively, it's also an important important thing to do. But do you have thoughts on that?
Look, I think a KOL can make or break you, quite honestly. And that's why I think it's really important to choose the right KOL. Because again, of how influenced the American can be, including the American hospital, the American doctor. It's not just the soccer mom, so to speak. And so having someone who's well respected in the community of their peers is, someone who can make just a huge difference. I'm actually working with a potential client right now, and we're talking about, who could be a good key opinion leader for them. And it, turns out that the past presidents of this particular trade association would be excellent because they were in a leadership role, they were in a national leadership role, they're respected by their peers, but now they're retired in terms of that position. They're still maybe active in private practice, or they're maybe doing some research, at a medical school, but they clearly have insight and respect. And I think that really can make a big difference if they go on the speaking circuit and start talking about the virtues and the value of this particular technology.
Yeah, no, that totally makes sense. Well, this has been fantastic, Mark. I guess I want to make sure I give you a chance. If there's anything you feel that needs to be added that would help life science companies sort of understand the realities and avoid the myths of U.S. market entry. Is there anything else you feel we need to, in this sort of short sort of Reader's Digest version of a conversation? Is there anything else that we should add?
I think I want to just emphasize what you shared with me and your listeners about your friend. I think that if they're interested in the U.S. market, they need to look at, what is important to physicians, doctors, hospitals, senior living care facilities, whatever their technology is, and look at how that can make a difference. Or they need to at least look at the situation at hand. And let me give an example. There is a company, again, I can't reveal their name, but they have developed what I consider to just be an amazing indoor air quality technology, which was recently tested within the COVID-19 environment to be, I think, 99.9%, I mean, some absurd number effective in cleaning the air around you. That's huge in this day and age of COVID. And, they're thinking about, they're looking at the US market, they look at the problems, they look at the size. And, one of the areas that they think this could make a difference in is, because the size of their unit is very, very small, is the transportation sector. So can you imagine having this device in every bus, in every subway, I guess it could be a taxi cab, but, larger transportation mechanisms, trains, planes. no one's necessarily thinking about that, but they were. And they looked at their technology, they looked at the size of the market, they looked at, it's a problem. I mean, how does the New York City subway system function in a time of COVID? Yes, you can have an N95 mask on, but if they want to keep it, going and it's full, I don't know about you, Bill, but I've been on a subway where it's not 6 feet, it's not 6 inches, it's maybe 6 millimeters. I'm touching elbow to elbow. How safe do I feel? But if I know that there is some type of system inside the train compartment that is cleaning the air as well as has been tested now, absolutely. And I think that's a great example of someone who has looked at the US market, may not have asked someone what's keeping you up at night, but was able to determine on their own based on a global pandemic that we're all living in. So I'm hopeful that within the next 6 months or less, some of your listeners will find themselves in a subway or a bus in Chicago or elsewhere, and this device might be there.
Wow, that's great. Yeah, no, it's remarkable how much different innovation is when there's actually demand. You not only end up with something that has product market fit, but a much better product because of all the feedback you get iteratively from those customers or potential acquirers. But good stuff. This has been fantastic. I think when we see technology companies in particular, that the challenge of sort of separating what we can make from what we should make is always a massive challenge. I think it's a real opportunity to help companies understand that and help them do it better. And certainly the U.S. market it's a unique place to enter. Well, this has been delightful. So what we're going to do, just so our listeners know and so we're going to put your information down the bottom here. So people who have more questions, which we absolutely encourage, that they get a hold of you directly. They can certainly get to us to have an introduction, but we'll make sure they know how to get a hold of you. And certainly we just so appreciate your time today, Mark. And it was a great conversation.
No, thank you, Bill. I appreciate the opportunity because I've come to realize that there are some wonderful companies out there. And if I can just help educate them just a little bit on the do's and don'ts, then the likelihood that they'll be successful is hopefully that much more. And that's what it's all about. It goes back to, helping innovative life science companies who can make a difference in the U.S. healthcare system, make it in the U.S. so we can all benefit from it.
Sounds like a good plan to me. I like that. Well, good. And to our listeners, thank you. Make sure that you like and subscribe so that we can keep you informed of all the great things that are coming out in podcast here. So thank you again, Mark. Thank you to our listeners, and we'll see you all real soon.